A yearly pap smear is a thing of the past, and not even the recent past. It has been a while since the guidelines have changed to where you don't need to have a pap smear every year if your paps are normal. So how often do you need pap smears, and what type of pap screening is even available? I'm Dr. Monica, board certified OBGYN, and in this video I want to take you through the types of screening we have for cervical cancer, when to start pap screening, and how often you actually need a pap smear, as well as exceptions to both the intervals of the screening and whether or not you need screening at all. The first thing I'll tell you about pap smears and cervical cancer screening and management of abnormal pap smears is that it is very complicated. It used to be a little bit more of a simple algorithm. You'd kind of follow a tree for what a pap smear was and what the result was and what came up from that to show you what to do. It's not really that straightforward anymore. So when it comes to abnormal pap smears, that is a different realm of what we're going to talk about in this video. I'm just going to talk about routine screening for someone who has not had any abnormal pap smears. So step one, when do we start getting pap smears? Answer is easy, it's age 21. Age 21 is when we start, although some people will have questions about if it should be sooner. So if someone's sexually active sooner, or, well, my mom said she started seeing the gynecologist at age 17. So sure, you might go to a gynecologist to talk about birth control or periods or any other GYN complaints, but we start doing actual pap screening at age 21. Now, what type of screening is there? The answer, there are 3 different ways to do cervical cancer screening. The first would be something called cytology. So this means that we're taking a look at the cells that were collected from the surface of the cervix to see if they look abnormal. That's all it is, looking at the cells, see if anything looks different. The second type of screening is HPV screening. So HPV, human papillomavirus, is a virus that's sexually transmitted, and we know that this is responsible for well over 90% of cervical cancers. This is the real problem agent when it comes to cervical cancers. So when screening, one option is to screen for the HPV virus. Now, the third option is to combine those two into something called co-testing. And this is when we screen by looking at the cytology, looking at the cells, and then automatically looking to see if the HPV is present. Now, most of the time what is seen is either the cytology only with a reflex to check for HPV only if a certain result comes up, or the co-testing. A recent update from ACOG actually supported doing HPV testing only, but that testing is not really widely available, so most of the time you're going to see either the co-testing or the cytology only with a reflex test. Now, we're trying to figure out how often you need that pap, right? So first of all, what looks into the interval of pap screening is your age. So between age 21 to 29 is going to be one age group, and then age 30 and older is going to be a different age group. So let's talk about the earlier age group first. So for age 21 to 29, the first recommendation to look at is which type of screening. The recommendation is to do cytology screening with that reflex to look at the HPV only if ascus comes up. Please check out my other video on ascus to see what that result means. If everything looks good, it's recommended to have that cytology only screening every 3 years. So if your pap is good, cells are normal, you come back in 3 years for your next one. Now, this does change once we get to the age 30. At 30, it is recommended to do either the high-risk HPV testing, or what's more commonly done is the co-testing. So we're still looking at those cells, but we're also automatically testing for HPV. And we're testing for HPV, it's also high-risk HPV. There are many, many different strains, but we're looking at a big group of the higher risk ones that are more likely to actually cause cervical cancer. So once you're 30, you get your co-testing pap and it's normal. How often do you need it? The answer is every 5 years. So every 5 years, you would come in for your pap smear, have your HPV tested as well. If your cells are normal, your HPV is negative, you're good for another 5 years. Now, let's say for whatever reason, your practice didn't do the HPV testing. A second tier of recommendation, but still acceptable way of doing the cervical cancer screening is to still do only the cytology testing. But if that is what's done, that has to be repeated every 3 years instead of 5. So this method of screening for cervical cancer via co-testing continues at 5-year intervals until the age of 65. At 65 is this glorious age where you get to stop doing pap screening if you qualify. So qualifying for discontinuing pap screening means you've had normal testing for at least 10 years prior to that time, and you've had testing that are negative in regular intervals in your prior years before reaching age 65. There are a lot of exceptions to that general idea of when you can discontinue paps at 65. If you had a history of a higher grade dysplasia, you need to continue pap screening for at least 25 years after. There are a couple different ways that testing out age is not going to apply to a certain person. person, so everybody's individual picture, of course, has to be looked at for that. So I'll see patients who are older than 65 and they'll say, well, why don't I have cervical cancer screening now? Does it not matter if I get cervical cancer? Do people not care about those of us who are over the age of 65? And of course, that is not the answer. But the reason behind it is that if you've been having Pap screening your whole life, you've had them at the intervals that you are supposed to, you've had negative testing, you've not had HPV. We know that HPV is what causes cervical cancer the vast majority of the time. If you don't have a new sexual partner, you're not going to get HPV. Your risk for having cervical cancer is extremely low. So if that is the type of population you fall into, there's just not a whole lot of point of doing cervical cancer screening. Now, again, exceptions. Someone older than 65 who comes in with postmenopausal bleeding or having any problems, we might take a Pap smear to make sure and check for that. But that general idea of someone who's low risk, they can stop doing Pap smears at 65. So these intervals that we talked about, every 3 years between age of 21 to 29 and every 5 years between age 30 and 65, that applies to normal Pap screening. So your Paps have been normal. If you have an abnormal, this is where we get into the vast array of what the management might be. And we can't really get into each different type of scenario that you might see. Once you've had an abnormal, you're not going to be able to just come every 3 or every 5 years. There's a certain amount of follow-up that happens in a closer interval, and then over time it can space out, again, depending on what the situation is. So here's a question I get a lot. What if I've had a hysterectomy? And that's a great question, because if you have had a total hysterectomy, which means that your uterus and your cervix were removed, because a total hysterectomy does not have anything to do with the ovaries. If your cervix was removed and your hysterectomy was done for something not related to a cervical dysplasia, so heavy bleeding or pelvic pain or fibroids or what have you, then you likely do not need to have Pap screening done. So conversely, if you had a hysterectomy and you had findings of high-grade dysplasia either in the reason that you had the hysterectomy done or shortly prior to the hysterectomy, if you've had advanced dysplasias, CIN2, CIN3, you do need to continue doing Pap screening of that vaginal cuff that stays behind after the hysterectomy. Otherwise, if that was not an issue, if your Paps were normal, your cervix was removed with the hysterectomy, your risk for cervical cancer is extremely minimal and you do not require Pap screening. Now, what I'll tell you about that is you have to ensure that your cervix was removed at the time of the hysterectomy. You would not believe how many times I have done an exam to go on a little search mission to see if someone's cervix is still there. Because a lot of times people don't know when they had their hysterectomy, they don't know for sure that their cervix was removed. If you had a vaginal hysterectomy or a laparoscopic assisted vaginal hysterectomy, most likely that cervix came out. But there are times that even with our laparoscopic approach, we do something called a supracervical hysterectomy, where the uterus is removed, but the cervix stays in place. If your cervix is still there, you still need to have Pap screening done. So that's a little rundown of when you need to have Pap screening done. Every 3 years up to age 30 or every 5 years after, assuming everything looks good. But it's okay to let go of the idea that you need to have a Pap smear done every year. Even if you were to become infected with HPV from a new partner and have dysplasias or abnormalities develop, that process goes extremely slowly. So it's not like 1 year you're gonna have a normal Pap and a year later you'd have cervical cancer or an advanced disease. It's a very slow moving process. So the intervals that we screen at are adequate to where we would still catch something if it did come up early enough to intervene and do something about it. So make sure you keep track of when you had your last Pap smear so you don't miss your interval. It can be a little bit harder to remember when you're not doing it every year, so make sure you keep track of when you need to go back in. As long as you're doing your intervals and you're following up as recommended by your practitioner, you should be fine and doing adequate screening for cervical cancer.